So welcome everyone. We have, how many people do we have online? About 35?
Yes.
40, fantastic. So we've got 40 people online, about 20 people in the room. Welcome everyone. And on this gorgeous autumn day, I just want to remind everyone to give thanks and be grateful to the land, the plants, the animals, especially in yet another week where watching the human news is almost unbearable. And to remember that we're on the traditional lands of many Indigenous people here in Canada, here in Guelph, obviously the Mississaugas of the Credit. And our speaker herself is Indigenous with a Cree background. Carly's family comes from the Cross Lake First Nation. As ever, they have a great website, which I would recommend that you look at. The Cross Lake First Nation is based 500 kilometers north of Winnipeg in Manitoba. From the website, it looks beautiful, but very remote. And from the website, you can see a number of themes that will be common to many nations. One is a great pride in their history. So the Cross Lake First Nations have been there for 10,000 years, and they regard themselves as having a history as long as the rivers and as long as the rivers flow and the trees grow, which is much more beautiful than the way that I said it. You'll also see from the website that they've also had some real challenges. There's drug issues on the website. They've had terrible rashes of suicides. And of course, much of this stems from residential schools, which you can learn about on their very good website. And the website is also full of hope as well, and good activities for the community and pride in their community and successes. And of course, one great success is Carly. So Carly is a bit of a superstar, and it's a real pleasure to have her here today. Excuse me, Dr. Carly Moody did her MSc at UBC. Oh, we have someone here to hopefully magic the projector into life, which is great. Thank you. So Carly did her MSc on mouse euthanasia with the UBC group. Then she did her PhD with Lee Neal here on how to handle stressed cats. Then she did a postdoc with Pat Turner on a whole bunch of interesting topics at Charles River. Looking at compassion fatigue and looking at enrichment for mice and a whole host of other things. And then a few years ago, she won a faculty position at UC Davis, where she has a position in welfare epidemiology, which proves to all of you in PopMed who hate doing epi, actually it's really, really useful. And she's currently developing a research program basically focusing on all things to do with interaction. So she's applying her applied ethology skills and her epidemiological skills to looking at welfare, the interactions between welfare and interactions. So interactions between animals in groups and when they go wrong, interactions between animals and humans and when they can be right and when they can go poorly because of mutual stress. So without further ado, I'm going to hand over to Carly. There may be a bit of, what do we want to do?
No, it's okay. We'll start it and
yes.
She'll do it online and then we'll the projector once our video and everything.
Marvelous. Thank you so much, Quinn. Okay, so we're just going to start as though everything's normal, and we're going to hear about optimal cat veterinary care for cats and how practices introduced by the pandemic worked or didn't. Thank you very much.
Thank you so much. Yeah, that was such a nice introduction. So I'm going to be talking about some research that we've been doing in my lab focused on virtual healthcare for cats. So I've been at UC Davis for 3 years. And so I'm going to talk about 3 different studies. I'll provide an introduction to virtual healthcare, and then I'll go and summarize 3 different studies that we've been working on the last couple of years. So getting right into it, there's estimated about over 90 million pet cats in the US and Canada. And of course, all of these cats require annual health care to help maintain their health and welfare. We know that a lot of cats don't receive annual health care. We know that more dogs are brought into clinics than cats. And this is thought to occur for a lot of different reasons. One is thought to be related to our differing attitudes towards cats compared to dogs. Cats are often thought as independent, low maintenance, self-sufficient pets. But we all know, of course, cats need just as much care as dogs do. Preventative health care, so that would be those annual veterinary visits, is really vital for preventing and managing health and behavior problems, as well as early detection of health problems, which may help increase the chance of successful management and treatment of an illness. So it really is a huge welfare issue if cats aren't receiving the care that they need. So given that cats aren't being taken to see a veterinarian, or a lot of them aren't being taken to see a veterinarian on a routine basis, there has been some initial work on identifying barriers which impact access to care. So there are some owner-related social barriers, or just barriers which can make taking their cat to the clinic challenging. And so this includes challenges related to travel, so perhaps not having reliable transportation, or traveling to your clinic takes a while, takes, a couple of hours with no close clinic nearby. This is particularly an issue for those living in rural communities. Senior owners may require assistance to help them get their cat into a carrier and travel to the clinic as well. And there's also, of course, economic reasons, such as unable to afford veterinary care. Home and work obligations can also limit the time available to take pets to the clinic. Or that ability to be away from home for a good amount of time. So there are a lot of different things we can think about when it's owner-specific barriers. We also have cat-specific barriers, such as difficulties with getting cats into carriers, stress related to traveling with their pet. Maybe it's a lot of vocalizations occurring, and that's really stressful. And owner perceived stress at the clinic. So we know clinic visits are stressful for cats. We have research showing that cats show signs of fear and aggression during routine examinations as well. And so that's well known. There's also been some work suggesting that owner perceived stress associated with clinic visits actually reduces their willingness to take their cat to a clinic, which is an issue. And we've also seen a big impact on access to care with the COVID-19 pandemic. And so that's really just those general concerns around health and safety. Many still have those concerns about infection risks. So there's that is still around. And there's a lot of barriers overall that pet owners and cat owners face. And so one potential strategy that could be used to help overcome some of these barriers is the use of veterinary telehealth. So veterinary telehealth is defined as all technology that can be used to remotely gather and deliver health information, health advice, education, and medical care. COVID-19 really led to a surge in the use of telehealth, particularly in the medical fields. We've seen a lot of acceptance of telehealth in human healthcare, which really has put increased pressure on the veterinary industry to sort of mirror what we're seeing in human medicine. But we aren't quite there yet for the veterinary medicine side of things. There's definitely some resistance, and we'll talk about that a little bit later. So telehealth can be divided into 5 categories. We have teletriage, teleconsulting, e-prescribing, telemonitoring, and telemedicine. But for the purposes of today's seminar, I'm just going to be focusing on telemedicine. So telemedicine is the practice of veterinary medicine at a distance, using electronic means and specifically focusing on exchange of medical information. It's really meant to be incorporated into current pet care practices to complement and enhance care, but not to replace in-person appointments. So I know there's definitely some anxiety around this, particularly from veterinarians, but the key is not to replace in-person appointments, but to sort of help enhance care and potentially make it more accessible. So telemedicine incorporates electronic communication and may involve applications that use video, which can expand really how telemedicine can be used. Using a video call allows a veterinarian and care staff to see the cat in their home environment, which allows the veterinary team a better chance of seeing normal behavior in a cat. So this is a really important benefit, since the stress related to a clinic environment we know alters normal cat behavior, can also alter physiological responses, and this can create challenges for the veterinary team. So the path to using veterinary telemedicine is through establishment of a veterinary client-patient relationship, which is also called a VCPR. And a VCPR really requires a number of things, but essentially the veterinarian has agreed to take responsibility for a pet's clinical care. They're responsible for maintaining the pet's medical records, and the veterinarian must have sufficient knowledge of the pet and is personally acquainted with the pet to initiate diagnosis and treatment of a pet's medical condition. If a VCPR is not established, a veterinarian can provide general advice, but essentially they do have to stay clear of diagnosing or treating pets. So depending on where you live, there are definitely a lot of different regulations and laws surrounding how a VCPR can be established. In the United States, most of the states require that a VCPR is not established virtually. So they require that it's must be established in person. In Ontario, a virtual VCPR has actually been possible since 2018. And because this was actually the first region in Canada or the US to allow this, it's really the go-to case study to argue for responsible use of telemedicine and veterinary medicine. So anytime I go to a lecture about telemedicine, I feel like I'm always hearing things about Ontario and how things have been going since 2018 to establish virtual VCPRs. California, which is where I am, really has some of the most restrictive regulations around using telemedicine. But since the start of the COVID-19 pandemic, there's definitely been a big change or a big push to change this. It was actually just announced on October 8th that there was a bill passed. It was Assembly Bill 1399. And it was signed into law, which allows a virtual VCPR to be established. And so this actually goes into effect on January 1st, which is really, really exciting and will definitely change how we're using telemedicine in California. So I think it's really exciting that we are progressing towards incorporating telemedicine into care and moving forward with this technology, because I really think it has a lot of potential to be very beneficial, particularly for cats. I think it can be used to increase access to health and behavior care for cats, and could be particularly useful to reach specialists that may not be available in all areas, for example, veterinary behaviorists. So this could actually help improve reach. I think everyone should have access to pet care, and telemedicine technologies can be used to reach underserved populations who may face more barriers to providing their cat with healthcare. In some ways, video telemedicine could be incorporated into care, include easy and quick follow-ups to assess cat progress at home, assess if a treatment is being followed, help the owner with any challenges they have, for example, suggestions to improving medication administration. We could also use it to support owners caring for pets that require extensive management at home. So for example, cats living with chronic diseases that require a high quality and quantity of care for an extended period of time. Technologies may also be helped. These technologies may also help with efficiencies. So for example, teletriage to manage appointments, which may help with the workforce shortages, increase the number of pets that can receive care. And personally, we have been working with telehealth companies. They've been helping us with our research and helping us recruit participants for our research as well. And for the veterinarians that we've spoken with that have moved from in-clinic work to working for these telehealth companies, whether it's part-time or full-time, anecdotally, they've really said that it's improved their work-life balance. They like the flexibility of being able to work from home at a different pace than a clinic environment. So I think we could definitely potentially see benefits, maybe for job satisfaction, work-life balance, that kind of thing, but definitely need more research to confirm this on a larger scale. But I think there's definitely potential there. So the research that I'm going to summarize today really focuses on 3 important populations that we should consider when we're thinking about incorporating video telemedicine into care with cats. The first most important population is cats, of course. We also have cat owners, so the caregiver's point of view, very important, as well as veterinarians and behaviorists that are providing cat care. So the first study that I'm going to summarize is definitely my favorite population to work with, which would be cats. And so the project that I'm going to talk about was run by Grace Boone, who was actually the first person to join my lab when I started at UC Davis 3 years ago. Grace is an assistant specialist, which is UC Davis's kind of term for a staff researcher. And since starting in my lab, Grace has really spearheaded a lot of the cat telehealth research that we do. So we know that clinic visits are quite stressful for cats. Research shows, of course, we know anyone who's worked with cats in a clinical setting also knows very well, cats show signs of fear and aggression during routine handling and examinations. And we also have owner reports that clinics are stressful for them as well. Video appointments are done at home and involve no travel or carriers for cats, and doesn't involve exposing cats to new people, animals, and new environments like a clinic does. And so we were really interested in examining cat and owner stress during video appointments. So for this project, we examined cat responses during in-person versus video telemedicine, mock spay, recheck appointments. And we predicted that cats would show reduced negative responses during that video appointment compared to an in-person appointment. We used spay recheck appointments because this is a reasonable appointment that you can use with video telemedicine. And it's also been recommended for use with video telemedicine by the Virtual Veterinary Care Association. And in this study, we also surveyed the participants to understand their attitudes about their experiences, both before participating in the research and then after participating in the appointments. And we predicted that participants would report that the video appointments were being lower stress for themselves and their cats. So to participate, owners had to live within 1 hour of the testing site in West Sacramento, California. They had to speak and read and write in English, since this research involved questionnaires, and participants had to be the primary caregiver of at least one cat. Cats had to be between 1 to 10 years of age. They had to be spay or neutered and healthy and not on any behavior modifying medications. We used an advertisement pictured to recruit local community members, which was advertised on social media as well. Grace dropped off flyers at local veterinary clinics, pet stores, groomers, coffee shops, anywhere that we would find cat owners. For this study, we used a within subject design, meaning that all cats and owners participated in both a Zoom and in-person appointment. And so we had a total of 30 participants with their cats. We blocked cats by sex and age and randomized cats to their first appointment assignment, counterbalancing appointment order. And we had a 2-week washout period between appointments. And for the Zoom appointments, owners were instructed to use their personal laptop computers, or they could also use a tablet if that's what they had. And we provided them with a webcam so that they could use that. And so everyone used the same webcam, and they were instructed to use a flat surface in the home, such as a floor or table, to place the computer or tablet on, and to ensure that their cat would be in view, like fully in view, the whole body in that picture, so that we could assess their behavior later on. So all appointments included a 5-minute habituation time, which is when the researcher really spoke with the owner about the cat and the appointment. And then during in-person visits, cats also underwent an approach test to assess if the cat would readily approach an unfamiliar researcher. The spay recheck appointment involved visually examining the cat's head, face, area, and then the owner was instructed to lift up the cat to show the research the spay incisional area. This appointment also involved respiratory rate and pupil pictures so that we could later assess cat pupil dilation ratio. And all appointments were video recorded so that we could score lip licking, ear positions. We're particularly interested in negatively associated ear positions, so side and back ear positions as well. We also looked for vocalizations. After the appointment ended, the cat was released by the owner, and we assessed latency to leave the examination area, and that was for about 30 seconds. So I know many people are aware of what an in-clinic examination looks like, so I wanted to play a clip of a video so you can see what one of the Zoom appointments looks like. And I just want to give you a heads up that there is no sound in this video. So...
Okay.
Oh, there is sound in this video.
Time of sleep scene.
I thought there was.
And the next thing that you'll go ahead and do is you'll use your arms on either side of her, and then you can use your hands under her chin. So you'll have her kind of face me, and you'll have her back, like her butt to you, basically. Perfect, just like that. And then you can use your hands under her chin, however you need to turn her so I can see her left ear. Beautiful. And then we'll turn her the other direction so I can see the right. Very good. And then we have her just kind of face. Great. That's really good. All right. And the next thing we're going to do is I'll have you lift her up under her underarms. You can kind of keep her back next to your chest for support. All right. And she can come back down.
So I won't play the whole thing, but that's essentially a little clip. I'm glad that the sound was working because I couldn't get it to work earlier. But essentially you'll see Grace was just instructing the owner throughout the exam of what to do so that we could ensure we could get visuals of the cat's abdomen, the head, the face, that kind of thing. So that's sort of how the Zoom appointments went. So we also had cat owners fill out surveys before participating in the appointments and then a survey after they participated in both appointments. So some of the things we asked are cat and owner previous veterinary experiences. We asked about the owner's experience with video telemedicine. Have they used it for themselves? Have they used it with their cat or another pet? And we also asked about perceived stress during video telemedicine and in-clinic appointments for themselves and their cat. So due to a lack of time, I'm not going to be able to touch on the survey results as much. And we also conducted a larger US-based study for cat owners that I'll summarize afterwards. So just a few results. I'm really just going to summarize the major results that we found. So again, we had 30 cats and their owners. On average, cats were about 4 years old. We had 16 males, 14 females. Most of the participants signing up were women, which is not surprising. And we had most of our participants aged between 18 and 39 years old. Most had used telemedicine for their own healthcare, and no one had used it with their cats. A large majority said they were very comfortable with using video platforms, accessing the technology and internet needed to perform video telemedicine. They could easily access, and they also stated that Zoom was very easy for them to access. So going through some cat response results, first is pupil dilation ratio. So you can see we have average pupil dilation ratio on the y-axis. And so a larger pupil dilation ratio basically essentially just means a larger pupil dilation. And so we have our in-person in blue and video telemedicine visit in purple. And you can see that we had a larger pupil dilation ratio on average during the in-person appointments compared to the video telemedicine appointments. We also assessed respiratory rates. We have the average breaths per minute on the y-axis and our treatments on the x-axis, so in-person in blue and video telemedicine in purple. And we found a lower respiratory rate during the telemedicine appointments compared to the in-person appointments. For ear position, we scored ear position at the end of 5 subsections of the exam. And so using those 5 ear scores, we summed the number of side and back ear positions so that cats received a score ranging from 0 to 5. Here is the graph for that. So we have number of cats on the y-axis and then our ear scores on the x-axis. And you can see that our in-persons in blue and purple is the video telemedicine. And so our results showed a difference between treatment and ear score. During the in-person appointments, we see that cats scored higher. We're seeing mostly 4s and 5s compared to the telemedicine appointments. We're seeing mostly 3s and 4s. So telemedicine appointments, we're still seeing negative ear positions. It's just not as negative as the in-person appointments. When examining escape behavior, we found that 28 cats in the in-person during the in-person appointments chose to move away from that handling area compared to 17 during the telemedicine appointments. Although we still have quite a few in both choosing to move away, it is less in the telemedicine appointment. So a few survey results. We wanted to understand how owners felt handling their cats for the appointment, as in the literature, you read that there's a worry that maybe cat owners don't feel comfortable handling their cats for telemedicine appointments. So We did ask them about this. We have our participants on the y-axis and our Likert scale on the x-axis, in-persons in blue, and the telemedicine appointments in purple. And so we had owners handle their cats during both appointments, just so we could have that consistency there for analyses. But overall, you can see that most participants for both in-person and telemedicine said that it was very easy or somewhat easy to handle their cat. So here we have survey results on reducing cat stress during the appointment. So we asked owners to rate how each appointment type reduces their cat stress. So it's just their perception of this. We have our participants on the y-axis and our Likert scale on the x-axis, and you can see telemedicine in purple. For reducing cat stress, very helpful, somewhat helpful, most people indicated, whereas for the in-person, most say that in-person visits are somewhat unhelpful and very unhelpful for reducing their cat stress. When it came to their own stress, again, very similar graph. We can see that for the telemedicine appointment in purple, people indicated that it was very helpful, somewhat helpful, or neutral for reducing their own stress during the appointment, and then using an in-person appointment was associated with neutral or somewhat unhelpful for reducing their own stress. We wanted to gauge overall interest in video telemedicine, and we found that it was pretty high both before and after participating in the study. So most participants stated that they were very interested or somewhat interested in using video telemedicine with their cat in the future. So in summary, cats showed more negative responses during in-person versus the video telemedicine appointments. And participants indicated that it was easy for them to access the technology and internet needed, and that handling their cat was somewhat easy, suggesting that many could likely handle their cat for video appointments. And participants indicated that video appointments would reduce stress for themselves and their cat, and that they are interested in using it in the future. So in conclusion, this is the first research to examine cat responses when undergoing an in-person versus a video telemedicine appointment. Our results suggest that video telemedicine appointments may provide a low-stress alternative to in-clinic appointments, which would be particularly useful for cats that show higher levels of stress during clinic appointments. We do need more research to evaluate cat responses during other appointment types for further assessment and replication of the study results. And one limitation of the survey results is that we did have a small sample of local cat owners. And so we really need more research to assess cat owner attitudes on a larger scale for better generalizability. And so that's sort of where we went next, is to create a large US-based cross-sectional online survey to better understand US cat owner attitudes towards using video telemedicine for accessing cat care. So this project was run by undergraduate researchers Sue Young Lee and Ashley Bigoli, as well as my assistant specialist, Grace Boone. For this study, we recruited current US cat owners, and they had to be 18 years of age or older. And an advertisement to participate was distributed online using social media. And we also had a popular science media article written about this, which helped with recruitment. The survey had 4 major sections. The first was participant demographics, so just getting at age, gender, where do they live, which state, rural, suburban, etc. We asked about experience with in-clinic appointments. So when was your last visit? What is your travel time to your clinic? How do you prepare your cat for visits? And then cat and owner stress levels. We also asked about experience with video telemedicine, such as access and comfort with technology needed and previous use with pets and their own medical care. And then finally, the last section looked at attitudes towards using in-clinic versus video telemedicine appointments. So getting them to rate differences of accessibility to cat care. We're also interested in would they be able to handle their cat for appointments. And we also asked about how much they would be willing to pay for video telemedicine appointments. So I'm going to summarize some of the major results. We just finished analyses and are working on updating the manuscript. So I'm not summarizing everything. This was a pretty large study, but I'm just going to summarize a few important results. So overall, we had just over 1,200 participants. Most of our respondents were between 30 to 60 years old, and they were from California. We had mostly women filling out our survey, 17% men and 3% identifying as non-binary. Most participants indicated they lived in suburban areas and had taken their cat to the vet in the past year, and most indicated that clinic visits with their cat is stressful. Most respondents stated that it was very easy for them to access the technology and internet needed to use video telemedicine, and a large majority indicated they had prior experience with the video conference platforms. Very few had used video telemedicine for their cats or another pet, but most had used it for their own healthcare. We also asked what they would be willing to pay for a video telemedicine appointment in comparison to an in-clinic appointment. Interestingly, we had about 50% of our participants indicating they would be willing to pay just a little bit less than an in-clinic appointment, while a few others said about the same or much less. So most said about a little less. We asked owners to rate their cat stress from 1 to 5, and they used a visual analog scale to do this. So 1 indicating very stressed and 5 indicating not at all stressed. And so for these results, you can see we have participants on the y-axis and our visual analog scale on the x-axis. Purple is our video telemedicine and blue is our in-clinic. So overall, you can see participants rated video telemedicine appointments as less stressful for their cat than in-clinic visits. So mostly blue over here and then purple over here. Using the same scale as the last question, we asked owners to rate their own stress during a clinic and telemedicine visit. And so we found that owners viewed telemedicine, which is in purple, as mostly 4s and 5s, some 3s, which would be neutral. So mostly not stressed. And then clinic visits is blue. So we see mostly 2s and 3s. So stressed and more neutral. We also asked about their accessibility to access cat care. So how would in-clinic versus telemedicine sort of impact their accessibility? And so we have our number of respondents on the y-axis and our Likert scale on the x-axis. And you can see for telemedicine, which is in purple, we have most participants indicating it would greatly improve or somewhat improve their accessibility to care. Whereas for in-clinic appointments, most indicated no difference or somewhat reduces. We wanted to know about their interest in using video telemedicine with their cat, and most stated they were very interested or somewhat interested in using video telemedicine for their cat in the future. And we also examined whether interest in video telemedicine was influenced by various factors that we had predicted would impact interest. And we found that those with a greater odds of being interested in using video telemedicine with their cat were older cat owners compared to younger cat owners, so 50 to 59 versus 18 to 29. Those that had a clinic travel time between 30 minutes to 1 hour were more interested compared to those who can travel to their clinic in under 30 minutes. And then finally, owners that are more stressed at the clinic compared to those that don't find a clinic visit very stressful. So in summary, most participants stated that it would be easy to access the necessary technology and internet needed to use video telemedicine. And most participants hadn't used telemedicine with their cat, but had used it for their own healthcare. So we know they have the experience sort of they're going off of is probably that with their own healthcare. Participants stated that using video telemedicine would reduce stress for themselves and their cats compared to in-clinic appointments. And overall, participants indicated that use of video telemedicine may help improve their access to cat care, which is a really important result. We also found that those interested in using telemedicine to access care tended to be older, had a longer travel time to the clinic, and find clinic visits stressful. So it may be important to provide the opportunity to use video telemedicine for these types of owners so that they can more easily provide care for their cat, or making it easier on them to provide care for their cat. One limitation with the study data was our participant base. Most lived in a suburban area and had taken their cat to the vet in the past year, meaning they likely value providing their cat with health care, and then they are likely more interested in the study topic, potentially more than the average owner. But we have more results to come. So again, just finished up the analyses, working on finalizing the manuscript. So hopefully that will, this paper will be out in a couple months. Okay, so the last study that I'm going to summarize is a study examining U.S. veterinarian and behaviorist attitudes on incorporating video telemedicine into care. This study was conducted by 2 undergraduate researchers, Liam Newquist and Anthony David. Study participants had to be U.S. veterinarians, veterinary behaviorists, and animal behaviorists that currently see cat patients. And we used social media to advertise the survey as well. Liam and Anthony emailed all of the state veterinary medical associations as well as other veterinary associations to really try to get our advertisement out and have people participate. We did conduct this study in 2021 during one of the COVID waves, which definitely impacted recruitment. So the questionnaire consisted of 3 main sections. We had demographic questions that focused on where do you live, so which state, location of work, is your clinic in a suburban area, rural area, or urban area, location of most of your clients, suburban, rural, or urban. We asked about age, length of time spent in their respective profession. Next, we asked about experience and interest using video telemedicine in practice. So have they used it before? In practice, do they have prior training to help them use this? And what types of platforms do they use? We asked about attitudes about incorporating video telemedicine into cat care. So opinions on reducing stress for the owner and animal, an impact on accessibility to care, types of appointments they would like to use telemedicine for. So we asked about both medical and behavior appointments, and if there's any differences between an appointment with a new patient, existing patient, and a follow-up appointment. So going into a summary of results, we ended up with 78 participants, most who were veterinarians who had been practicing for 6 or more years. Most of our participants were between the ages of 30 to 50 and had clients living in a suburban area. Most participants had not received formal training on how to use video telemedicine in clinical practice, and about half had used video telemedicine with cats before. And for those that had used video telemedicine before, most had used Zoom or Microsoft Teams. Overall, we found that participants that had been trained on how to use video telemedicine with clients had a greater odds of using it with cats compared to those that hadn't been trained. So this was a really interesting result because it shows the impact of training. We also found that behaviorists and veterinary behaviorist participants were more likely to have used video telemedicine with cats compared to veterinarians, which to us was not super surprising. We asked participants about the different types of appointments they would be interested in using video telemedicine for. So here's a table summarizing this data for medical appointments. And since this question focused on medical appointments, only veterinarians and veterinary behaviorists answered this question, and none of our behaviorist participants saw this question. And so we specifically asked about medical appointments with new patients, existing patients, and follow-ups. So for new patients, most veterinarians and veterinary behaviorists indicated they're just not interested in using it. When it came to existing patients, we have veterinarians were split with just below 50% indicating they would be interested in using it, while over 50%, so 53% indicated they would not be interested. Whereas for veterinary behaviorists, we have most indicating they would not be interested. And then when it came to follow-up appointments, most veterinarian and veterinary behaviorists were interested in using video telemedicine for follow-up medical appointments, which is great to see. When asking about the use of video telemedicine for behavior appointments, this question, all of the participants saw it. And so we asked specifically about new patient, existing patient, and follow-up appointments. And we found that when it comes to new patient behavior appointments, veterinarians were not interested in using it, while both veterinary behaviorists and behaviorists were. When it comes to using video telemedicine with existing patients, we found that all three groups, the majority, were interested in using video telemedicine. And then when it came to follow-up appointments, again, the majority of all three groups were interested in using video telemedicine. So here we have a graph with results on the impact of video telemedicine on cat stress. Veterinarian responses are in red, and veterinary behaviorists are in orange, and behaviorists are in yellow. So you can see most veterinary behaviorists and behaviorists stated that it would not be stressful at all, whereas veterinarians had more of a mixed result, with some saying is neutral, neutral here and not very stressful. When asked about cat stress, during in-clinic visits, most respondents indicated these appointments. Oh, I just realized the second one should actually be, this one, sorry, should actually be owner stress. This one's cat stress. Sorry about that. I just realized there is an error on my slide. So for owner stress, not very stressful, neutral, and then not stressful at all for video telemedicine. And then for cat stress in clinic, these indicated very stressful. Veterinarians stated more stressful, whereas veterinary behaviorists stated mostly stressful, and our behaviors very stressful. So we can see that cat stress during video telemedicine and clinic appointments would overall, we see that video telemedicine would help reduce stress. Impact on accessibility to cat care for cat owners, veterinarian responses are in red, and veterinary behaviorists orange, and behaviorists are in yellow. We see that most veterinary behaviorists and behaviorists indicated that telemedicine greatly increases access to cat care, whereas we had a mix from veterinarians, with most stating it would increase access and some stating it would have a neutral impact. So in summary, most participants recognize that video telemedicine would reduce cat stress and increase access to care. When it comes to using video telemedicine for medical problems, veterinarians and veterinary behaviorists stated they're mostly interested in using it for follow-up appointments. And then when it comes to using video telemedicine for behavior problems, we see that veterinary behaviorists and behaviorists were interested in using it for all three types. So new patient, existing patient, and follow-up appointments, whereas veterinarians indicated being interested in using it for existing patient and follow-ups. One major limitation of this research was sample size. We really had serious challenges with recruitment, and I think it was really the timing of data collection, which partially occurred during a wave of COVID-19. And it was just hard to reach people working in the veterinary industry. So overall, our small sample limits the generalizability of the results. However, we did like that we had a good representation of those who had and hadn't used video telemedicine with cats. So about 50% of our participants had actually used it before. So overall, more research is needed. Very little is known. We need more research to examine how we can use video telemedicine in practice, and we need to better understand how it can be incorporated into care in a way that is effective and beneficial for everyone involved. It would be interesting to examine current training programs for video telemedicine and see how this impacts efficacy of use in practice. We also have so much to explore when it comes to electronic communication in general for enhancing care. So for example, teletriage to increase efficiencies in veterinary clinics and how this may be used to increase access to care. Another area where we are currently doing work is examining use of video appointments for routine check-ins with owners that are caring for cats with living with chronic health conditions. And so this focuses more on support and general advice for improving the management of care in the home. I think it would also be interesting to assess telehealth in other veterinary environments, such as animal shelters. We know it could likely be used for preventing and managing health issues to keep pets in their homes, rather than having them being surrendered to a shelter just to receive the care that they need. And so I think there's going to be a lot of ways that we can incorporate telehealth into care, and this is really just the beginning. And there's so much that we don't know yet. So I just want to thank my collaborators, all of the students that work so hard on these projects, as well as the ASPCA and Maddie's Fund for funding some of this work. So I'm happy to take any questions